So, hey everyone, this is Danielle. No Elliott this week. He is off doing some more exciting things somewhere, probably.
Oh, nothing more exciting than this. What's more exciting than a conversation about healthcare?
Yeah. And this is Cobi, our legislative director, filling in.
Hi, everyone. I'm the excitement now that Elliott's missing.
Yeah.
Evening here. I mean, YouTube, you could be watching it whenever. Who knows? Maybe it's morning for you.
That's true. I release them at like 8 or 9 in the morning usually.
Have it with their coffee.
Yeah. Morning dog walk.
Yeah. Good morning, Libertarians. Maybe we should change the title of the show.
Yeah. Spike's podcast, one of them, they say good morning, good evening, and good night or something.
Yeah. Yeah, I just don't know how you guys bring that much energy to these shows. I get a different personality. I sit behind a computer and type stuff all day. So you guys don't understand how I do that.
It's true. When I'm sitting around on the computer typing all day, I'm just a jerk. So...
Yeah. Well, me too, but sometimes they pay me to be a jerk.
Oh, well.
Unfortunate side effect of management. Well, cool. You wanted to have a conversation about healthcare. We're working on a healthcare proposal right now, Libertarian platform healthcare proposal. We haven't run it through everybody yet. It's not fully vetted out and approved, but I think it's a good alternative to what we have now and the other suggestions that are on the table for solving our healthcare problem. Because we do have a healthcare problem. What we have now is not capitalism, first of all, but it's also horrendous. I don't think anybody in their right mind would defend the current state of our healthcare system. Yeah, and maybe, I don't know. I guess I should ask that before I make a statement.
I'm sure that the people making good money are pretty happy with that.
Well, sure, yeah. I guess if you own a multinational insurance conglomerate, then you're probably pretty pleased. But for the rest of the peons, myself included, I don't think we're so happy with it. So anyway, I think everybody has heard about single payer, and there's a push right now in Washington State to implement a statewide single payer system called Whole Health Washington.
Oh yeah.
And yeah, you're familiar with it?
A little bit.
This would be a state-sponsored and organized health insurance program, which would be operated by a number of different appointed committees who would determine what form of health care the state would be willing to offer every individual, working, non-working, homeless, pre-existing conditions, all of it. Doesn't matter. If you are an individual who lives in the state of Washington, they would provide you complete health care. It's kind of like it's a fantasy is really what it is, but there's a large push for it right now. And I think there's a larger push for single payer healthcare. Of course, Bernie Sanders popularized the idea nationwide. And we don't think single payer, well, at least I don't think single payer healthcare would work. And I don't think any libertarian payer healthcare would work. But the question that we often get asked is, well, that's great. You keep poking holes in everyone else's ideas. The current system sucks. Single payer sucks. But what alternative are you really offering? And up until recently, the answer to that has been, well, just, let the market handle it. Don't do anything. Get rid of all the regulations and everything else will figure itself out. And, I appreciate I'm a libertarian. I recognize the value of the free market, and I appreciate that might someday work itself out. But we're so far entrenched in the system that we're in now, due to some combination of government interference and corporate factors, that you can't just deregulate the market and have it solve itself. At least I don't think you can just deregulate the market and have it solve itself. And that's usually where the conversation stops, because what other solution can libertarians offer? So I've tried to bring a solution to the table that balances government intervention, which I want to be very respectful of that. When the government intervenes in the market, we don't generally like that. But I personally believe that there's a time and place for it, and that time and place is usually when there's fraud in the market or there's coercion in the market, like in the case of a monopoly or in the case of some false advertising scheme, or when the people operating in the market are irrational, such as advertising to children. That I think you can make a reasonable argument, even as a libertarian, that the government has an obligation to regulate that to some degree.
Mm-hmm.
In order for capitalism to work, those three things need to be accounted for. You need perfect information, theoretically, rational thought, theoretically, and voluntary exchange.
Sure.
So what I'm proposing is, or specifically Washington State, because I'm the state Libertarian Party legislator. I don't have the ability to change national as much as I'd like to. What we're proposing is to require healthcare providers to provide free information. And what I mean by that is, if you go to a doctor's office now and you ask them how much it's going to cost to see the doctor, they're going to ask you for your insurance information, and then they're going to call your insurance company and in some back door figure out how much it should cost, and then your insurance company is going to pay for it. Now, that is not a traditional competitive market. That is like a voluntary socialist market where fear has driven everybody to these health insurance companies. And now the health insurance companies regulate the market in a way that isn't too dissimilar from how a government would do it, in my opinion. And I think that you should be able to walk into a doctor's office and the doctor should tell you that it's going to cost however much money for however much of his time. And you pay for it and you have your doctor's appointment. There's no insurance company. There's no collusion. There's no, let me call and talk to somebody else and figure out what deal I have with him this week. You get to bargain for your own care. And the way that we would accomplish that within the state is we would require all healthcare providers to offer a direct pay option to consumers. And in addition to that, we would require that they also publicly post all of their billable rates for time, materials, drugs. And that, everyone's argument to that is, well, that's impossible. There's so many different drugs and different rates of time for a doctor or a regular physician or an anesthesiologist. I mean, there's no way you could quantify that. And I say, well, I'm a general contractor. Yes, you
Yeah.
can. My list, when I sign a contract, I have to tell people what board foot of lumber I'm going to charge.
I'm going to school for project management, and my project is a home building project. And they gave me price for labor, and I had to calculate how much all the labor was going to cost and add in all the quotes. Yeah, I believe you.
If I sign,
my brain exploded.
That's right. If I'm going to sign a time and materials agreement, I'm going to agree what the cost of yard disposal is, whether it's contaminated, non-contaminated, based on the number of fines that are in it. I mean, yeah, it's complex, but you know what? You can do it. And in order to provide consumers with the information they need to make an informed decision about what doctor they're going to see and at what price they're going to pay that doctor, I think it's appropriate for the government to demand that healthcare providers provide that information to the public, not to some insurance company. And, the rates don't change if it's an insurance company or if it's a consumer. It's publicly posted on their website. And theoretically, what that will do is it will allow the market to be more consumer driven. In other words, now you don't have a large insurance company with deep pockets paying tens of thousands of dollars for a health appointment because it can afford it. You have, thousands of individuals with regular budgets. Maybe they're making $50,000, $60,000 a year if they're a household of two on minimum wage. And now the healthcare providers have to find a way to service their needs instead of the needs of this massive pool of people who are in large healthy and are just paying more to help the one sick person of the hundreds of thousands of people who are participating in these programs. So it's not a hard line. I mean, we're not eliminating insurance. I don't think you can do that statewide. I think you'd have to tackle the collusion monopoly problem on the federal level. But what it does is it at least allows us to have a conversation about the actual cost of healthcare. Because now you can go online and you can figure out what the doctors are charging and you can compare providers, right? If you want to see a doctor and you've got X number of dollars to spend, you can't compare providers. You have to compare insurance companies, and insurance companies are, taking profit on top of whatever you're paying them. So, I mean, great for a healthcare provider to earn profit. I mean, they're adding value, but an insurance company, whether they're adding value is a little bit more questionable.
Something that I've heard people, when it comes to this healthcare choice issue, especially when it comes to price, is actually being able to choose what kind of provider they get to see, whether they want to see an RN or a PA or a full doctor. Do you have provisions for any of that kind of thing in there where like people have the right to see the lowest
Yes.
uh, qualified provider according to their price point?
Yeah. So by requiring healthcare providers to provide consumer-facing services and offer direct pay options, you as an individual would be able to go online, find a doctor that works for you, that you can validate their credentials yourself, and read the reviews of that particular doctor and decide who you want to see and at what price. And you're going to have to pay out of pocket for it, but theoretically you're able to do that now if you're not paying for insurance. I mean, 90% of the reason people pay for insurance is because it's like impossible to see a doctor otherwise. And everybody's signed up with their own different conglomerate, and if you want services from them, you have to be in their network. And if you're not in their network, well, then they're going to charge you, however much more. So what this legislation is trying to accomplish is it's trying to add freedom of choice for the consumer, and that everyone has to provide services to everybody, not just some in-network monopoly. And then it also creates a competitive environment where now, one guy's price is X and the guy next door is Y. They're going to start competing with each other. Now, there's another issue with the competitive nature of healthcare in our state, and that is a certificate of need. Are you familiar with what the certificate of need is?
That is one of Spike's talking points when he was running for president. He was talking about how you can't open up a new hospital in an area that the government doesn't deem in need of that facility. Is that close?
That's really, yep, yep, that's pretty close. It has, I haven't totally followed Spike's campaign in detail. I knew that was part of his platform, but has he described the history of the certificate of need and where it comes from and what its purpose was originally for?
I'm sure he does somewhere, but our listeners would probably love to
Sure.
hear you do it too.
Sure. So back on the early eve of this idea of socialized medicine, Medicare, Medicaid, Social Security, um, the government was faced with a problem. The federal government was faced with a problem, and that was they had a limited number of resources to serve an unlimited need to a theoretically unlimited number of people, which, well, gosh, that's the whole reason why single payer healthcare doesn't work. But anyway, so their solution at the time to that problem was to create the certificate of need. And the theory was that if the government was able to limit the amount of service providers that provided healthcare services under Medicare, Medicaid, or Social Security doesn't really count. That's not a good example, but Medicare or Medicaid, then the government could then quantify approximately how many dollars they were going to spend, because each one of those facilities which existed would create effectively a limited variable for them to account for this new government expense. And they must not have talked to an economist, because what happens when you limit the supply of something? I mean, it's not like the price, maybe if it was a government facility providing public services and they were nonprofits, you could limit it to some degree. But if you limit the supply of something and you've got an unlimited demand for it, well, prices go up. And that's exactly what happened. Prices skyrocketed. And then the solution to that was private insurance. And then prices skyrocketed more because the deep pockets just kept getting bigger. So the federal government did away with the certificate of need program. It doesn't exist on a federal level anymore because it was kind of a flawed idea to begin with, and they realized it didn't work. However, the state of Washington still has that same certificate of need program. It deliberately limits the supply of healthcare providers, originally in an effort to limit the amount of government services and resources that were being spent. But number one, that isn't even an issue anymore, and the certificate of need didn't even solve that issue. So what it's used for now, more primarily, and I won't name names, but it's really a form of health service protectionism. What it does is if there's a particular healthcare provider in a particular neighborhood who gets a certificate of need, Well, now they have the ability to limit the competition in that neighborhood. They can say, no, we've already got a service provider here. We don't need another one. And now there is no competition. There's nothing driving prices down. So that is precisely why, well, not entirely why, but it's in part why our current system really isn't indicative at all of what a competitive free market looks like. So I think to combat that, the answer isn't more government bureaucracy with, a bigger committee that works for the people. It doesn't solve the problem. The only way you can solve the problem, in my opinion, is by refacilitating a free market that services a consumer-driven, competitive, free healthcare market. And I think that our state could serve as a good test subject to that. We don't even have to eliminate healthcare services, healthcare insurance entirely. So unions, people who currently have healthcare policies, those aren't going to go away. All I'm suggesting is a moderate step to lift the wool that's over everybody's eyes about what prices healthcare providers are actually charging their insurance companies, you and the government. Number one. And number two, give everyone an opportunity to deal directly with their healthcare provider without having to go through a third party.
Yeah, so I had an interesting encounter with a dentist today, and it actually resolved in my favor. So I'm not gonna like say that they're awful. Um, but they were like super late, and I was kind of annoyed, and I was just like, I want to be out here by whatever time. And they like tried, and they got to that point, and they were like, hey, sorry, like can I just finish? I'll give you your next two fillings free and this visit free. And I was like, dang, like
Yeah,
how? They're like, we won't bill your insurance. I don't think you were gonna pay for this anyways, but we just won't bill your insurance. I'm like, but
right. It's like, number one, what good does that do you?
yeah,
Number two, you know, you don't know that amount, and you don't know what they were going to pay the insurance company anyway. It's like they're giving you a gift on. It's just
yeah.
the whole current situation is a complete and utter mess. Oh, there's also a provision that I've incorporated in there, which gives a statute of limitations on the time frame insurance companies have to bill people. I think everybody, well, maybe not everybody, but a large percentage of people, I'm sure, have gotten, the medical bill that's 2 years late. And I mean, how can you remember that you went to the doctor 3 years ago and it cost, and you didn't even know how much it cost at the time? You just saw the doctor 3 years
Yeah.
ago. 2 years later, you get a $4,000 bill. It's total and complete nonsense. It's like complete unfettered. It's a monopoly, is what it is, and it's unreasonable not to bill somebody for 2 years. And the fact that there's no recourse is pretty ridiculous. So I think I incorporated a 6 month billing limitation, and that if an insurance company fails to deliver a bill within 6 months, the bill is waived.
Oh yeah.
Which is also somebody could question the libertarian merits of that, but I think given the lack of information, the level of coercion and involved in the healthcare market, I think it's warranted.
I mean, most other services bill within that time frame, and I do
Right.
think that
And,
kind of
and
statute of limitations makes sense, especially for something like that.
you could argue that it wouldn't make sense in other industries because the reason other industries bill you on time is so that you don't take your services and your business someplace else.
Hmm.
If your insurance company doesn't bill you on time, where else are you going to go? It's your employer's job to operate your insurance company. You don't get to choose.
Yeah.
You have to do business with whoever you're stuck with. Not up to you. And so there's no level of customer service whatsoever, and there's no competition. Really, there isn't. You don't get to choose your insurance company. If you can't choose your insurance company, it's not a competitive market. It doesn't work.
Yeah. And I know that because I had a union job when I was in social work, and I know that there were like negotiations and they were looking at insurance plans that would suit, the majority of the members, and they polled everybody to see what we wanted in our insurance. But yeah, ultimately, like, I'm a childless person that is about to have surgery to never be able to have children. I don't want the plan that gives me all these benefits for maternity leave.
Yep. Why would you pay for that? It's unfair of you to have to pay for services you're never going to use. And ultimately, what happens is the dollars that you're paying into that program, which you're never going to use, go to inflate the market because now they have more buying power. It's not their money. They don't have any incentive to bargain the cost of birth down. Not really. And anyway, it's just the current system is really not much better than a single payer system, and a single payer system really doesn't do anything to solve the current there is one other element to the bill that I forgot to mention, and being able to directly pay for your healthcare is great if you have the money to do it, and not everybody has the money to do it. So what I've also suggested is creating and this one is a little bit more negotiable. I've gotten some pushback on this for legitimate reasons, but I've suggested that we create a high deductible, ridiculously high deductible government plan. And when I say high deductible, I mean like $100 million deductible. Like you're never going to hit the deductible period. But what that would do is it would allow everybody, regardless of pre-existing conditions, whatever, to sign up for this centralized plan, which is ultimately not administered, which would make them eligible for an HSA account because they would be participating in a high deductible plan. And then you would not have to be employed to get an HSA account or have a different high deductible plan to get an HSA account. Everybody would then become eligible for HSA. And an HSA is kind of a tax haven account. Everything you put in there, everything it earns, and everything you take out is not taxable because it's used solely for health expenses.
And that's so it's like a portion of your pre-tax income you can put into this, and then you take it out to pay for like health services or reimburse yourself or whatever.
That's exactly right. And I don't remember the limits. They're pretty low federally right now. I think it's 3,500 for singles and 7,000 for couples. Don't quote me on that. It changes every year. But it's someday I'd like to be able to convince the federal government to increase that limit, but I am not there yet. So, but what it would do is it would allow people to make pre-tax contributions into that account, and that money is not taxed. And then any growth that you get within that account, if you invest the money, is also not taxed. And when you take the money out to spend it on medical services, it's also not taxed. So it is like one of the only truly tax-free accounts that exist. And a centralized high deductible state program would give everybody equal access to that account, which would allow them to save tax-free dollars for them to go use and spend directly with a healthcare provider that suits their needs.
Yeah, that sounds great.
Yeah, I think
That's actually I've never taken advantage of an HSA because all of those things they like throw like 15 different things at you when you like get hired somewhere, and I
right.
just didn't understand any of them enough to sign up for them.
I like HSA accounts a lot. It gives you a high level of individual flexibility. If you're a young person, it gives you the opportunity to grow money tax free, so that when you're older, you can afford to get whatever healthcare you want and pay for your own needs. And you get to manage your own money. You get to choose which healthcare provider you want to work with, and you also get to use it for self-care. So you can use it for anything healthcare related. You can buy toothpaste, deodorant. And you can go to the grocery store and get a debit card and pay for your health needs with money out of that account. And I think it's just a wonderful way to help working class people who are overly taxed, in my opinion, to use money that would other go to a bureaucracy to take care of themselves. And I think giving everyone the opportunity to participate in that is imperative to any form of competitive market.
And that's actually really great because a lot of people and I'm not sure where this argument comes from, but I hear a lot of people that don't like consumption taxes or like sales tax or whatever. They don't like that because they say it actually affects poor people more than income tax. This would help those people see that, like, okay, well, without an income tax, we can tax other things, but like at least these things that people need, because that's always their thing. They're like, they need to buy this, and this, and they can't afford it because of the sales tax.
Yeah, and usually, by the way, this, and this, and this are not actually subject to sales tax. Like unprepared food.
Yeah.
No sales tax. We don't charge. Well, generally, we don't charge sales tax on living necessities.
Things about this, and the bill in the description.
Yeah.
I guess you'll have to message that to me.
It's a letter of intent right now, so I guess I should go through that process real quick. What we do is we write a letter of intent that everybody within the party gets to contribute to. We redline it, and we more or less outline the terms and conditions that we want to stipulate in a bill. And then we take that letter of intent and we send it to an attorney, and the attorney actually drafts and writes a real bill, and then we take that bill and send it to our representatives who currently work at the state legislature, and then also offer it to people who want to run on the Libertarian ticket. So what will be in the description is going to be our current working document, which is a letter of intent. And if you'd like to see that letter of intent become a real piece of legislation and you agree with it and you want us to lobby for it, sign up as a member, donate to the party, and we'll pay our attorney to draft up a real bill, and we'll go out and start lobbying the state legislature. That's kind of the outline of the process.
Yeah, and speaking of donating money, we are looking at a couple events in August, maybe a King County centered one, and then a big fundraiser in September. So definitely check those out. You can always donate at lpwa.org.
Well, awesome. Thanks for hosting. Too bad Elliott wasn't available, but it was good to hear from you.
Yeah, we'll miss him.
Yeah, well, I mean, he'll be back next week.
I guess he'll be back next week.
Forever.
That's true. Yeah, I was like acting like he's dead. Sorry, Elliott is not dead.
Yeah.
It just feels like it in my heart.
Oh, so that's my rant about healthcare, and that's my proposed solution. I hope to get some level of traction on it, and maybe I'll post the bill and a link in the description.
Oh yeah, that'd be great.
But if you're interested in actually reading the bill, then you could also sign up as a member. And offer your input on changes that we should make to it to better accommodate everyone.
Yeah, that would be great. We're always looking for volunteers for a lot of our committees, obviously legislative committee. How can folks reach you, Cobi, if they want to help out with this stuff? Just the Discord?
Discord, or they could email me now. I got my email, cobi@lpwa.org.
Nice. All right. Well, you have a good rest of your evening, Cobi, and I'll talk to you next time.
Talk to you then.
Don't forget to like and subscribe.
I highly recommend that you sign up as a member for Libertarian Party. It's like $25 a year.
lpwa.org.